Assalamu alaikum wa rahmatullahi wa barakatuh. This is your brother Omer Chaudhry. I'm from the United States in Pennsylvania. I'm a physician in Lehigh Valley Hospital. I work as a neonatologist. So I came to visit. I'm a longtime donor of Helping Hand. I came to visit this beautiful facility in the beautiful city of Mansehra, surrounded by mountains. So we have a Helping Hand facility here. It's a rehabilitation center. So I visited almost every department inside the building. Extremely, extremely impressive. I've been very impressed by the professionalism of the staff. Each individual department has cutting edge technology, very, very high standards, alhamdulillah. So we'll come inside the hospital and give you a brief introduction. So this is the reception here. So as you can see here, we have a check-in center here. Patients, it's all digital. They can just press new patient, follow patient. Once you do that, you get a ticket here with a number on it, number 12. You do a follow-up, you get your different number, A and B. Once you're called, you go to the center here, and people are checking in. So people check in. There's no long wait time here. It's very organized, very easy process. And then they have way more than just rehabilitation services here. They have physical therapy, occupational therapy, males and females separate, that does everything from speech therapy to occupational therapy to anything else you can imagine. They do prosthetics, orthotics, very, very professional work, language therapy. All ages, from babies, newborn babies, all the way up to elderly. And they have various different departments for each of those. Also with the technology, I was extremely impressed with the technology I've seen here. Honestly, and I'm not just saying that for this video, deeply from the bottom of my heart, I was very impressed by the professionalism, by the friendliness of the staff, by how hardworking they all are, by how clean the facility is, every single aspect, and each individual department I was very impressed by. So we have Dr. Prasada Khatak here. He can give us a little bit more detail on the individual departments here. I just gave you a brief overview. Speech therapy, occupational therapy, physical therapy, and prosthetics, orthotics. Anything else you want to add to this?
Thank you so much. Sir. My name is Dr. Prasada Khatak, and I am working here as a rehabilitation superintendent. Basically, Helping Hand Comprehensive Physical Rehabilitation Center is working since 2006, and we are providing comprehensive physical rehabilitation services, including physical therapy, and with different kind of musculoskeletal neuromuscular conditions. Patients with different kind of musculoskeletal neuromuscular conditions are coming to us, like cervical spondylosis, cervical radiculopathy, lumbar spondylosis, osteoarthritis, and different kinds of like post-traumatic, patient with post-traumatic injuries. We are also having the neurological unit in physical therapy, in which the stroke patients are coming to us, and patients with different kind of nerve injuries are also availing our services. We have the separate services for the male patient and for the female patient, and we have the occupational therapy service here, in which our occupational therapist is basically working on the activity of daily living, like a patient cannot do buttoning, and he cannot on and off his shoes, he cannot dress and undress, and he is having difficulty in signature and other daily activity of daily living. We are also having the sensory therapy room, in which if a patient is having high sensation or low sensation, our team is working on that. We are also having the P&O, prosthetic and orthotic department, in which we are providing specialized services for the patient. There are basically two services. The one is orthot, in which we are providing the orthotic service, like a patient is having wrist drop or foot drop, or he is having post-polio paralysis. and he is working with the hand to knee gait, so we are providing the care to them. If a patient is having scoliosis, like he is having pain in his back, we are providing the TLSO, thoracolumbo-sacral orthosis, and we are having the speech therapy department in which we are working on the speech and language. Like some patients, they cannot listen, so they don't speak, so we are working on that. Secondly, we are having the department of psychotherapy, in which the stroke patients are coming to us. Like before stroke, they were running their family, and after stroke they get weaknesses in their upper limb and lower limb. So our psychologist is also working on that, like they are having depression, anxiety. So the psychologist is working with them. So this is the comprehensive setup, like all under one roof. The physical therapist is working, the occupational therapist is working, the speech therapist is working, the prosthetic orthotic is working, and now we are also providing the audiological services, like a patient who is not listening due to any reason by birth, or they may got some injury after birth. So we are also providing the audiological services. And currently, the patients are coming to us with autism, that is virtual autism, like they are doing scrolling, and there is one-way communication, and they lost their social activities. So our team is also, our occupational therapist or speech therapist and our psychologist is working on that as well. And in 2025, we are also going to start their services, the autism unit.
So there's a very increased incidence of autism recently, and theories are that it's related to the increased use of smartphones in children. So that's something they focus on here, to build the language skills and emotional attachment to the parents through various therapies. One other thing I wanted to highlight was the orphan support program. So there's a very healthy program here of supporting orphans. And if an orphan cannot pay for his own medical care, then they cover that 100%. Not just the medical care, but also their education. There's various programs to support the education of orphans so that they can be more functional in society and work jobs and have a decent chance at living. So it's a very, very comprehensive program, very impressive. Alhamdulillah. So we want to thank all the donors that have been donating to Helping Hand throughout the years. This has been here for almost 20 years. So thank you to all the donors, and I want to encourage increasing donation, either yourselves or encourage it to others. Yes.
So actually daily around 300 patients are visiting us, and most of the patients, they comes on wheelchair, like they are having amputation, and we are providing the artificial limb to them, and they start walking, and they're joining their social activities again, they are joining their business again. And secondly, patients who got stroke, paralysis, so we are treating them, and once again they start walk and join their activities, and they become fruitful men of this society. So we are thankful to you and our donor. So we have visited.
So please donate, inshallah. I encourage everyone to donate as much as you can. Spread the word. There's very, very great work being done here. I've spoken to parents myself who have seen their children who were not able to walk, were not able to talk, and in the office they're saying 6 months later, 1 year later, now they're talking or walking, and now they're functioning. So that experience is something that's priceless. So no matter how much you donate, may Allah reward you and increase that as much as you can, inshallah. Thank you.